Call your first witness.
Thank you, Your Honor. The state calls Jason Schultz.
One of them power drinks? I could probably use one, but that's okay. I unfortunately slept too much last night. You solemnly swear to tell the truth, the whole truth, none but the truth, so help you God. Why don't you make yourself comfortable there? You got that mic there in front of you.
Okay.
Okay, it's an area mic, so it should pick up your voice, but I need you to enunciate. Go ahead and state your name for the record and spell it for us.
Jason Schultze, Jason. Last name Schultze, Schulze.
Some of the jurors are straining there, so give me a little bit more volume, okay?
Okay. Jason.
Oh, the glass doesn't help.
Okay, Roger.
Okay? Go ahead, state your name again.
Oh, Jason, first name Jason, Jason. Last name Schultze, Schulze.
You guys hear him okay? Mr. Zion?
Thank you, sir. How old are you? 36. Where did you grow up? Lima, Ohio, or around Lima. Okay. What did you, at any point during your high school years, did you join the military? I did at 17, yes. All right. At any point after you joined the military, did you finish high school? I did. All right. What did you do after high school? I attended OSU Lima to try to get in the nursing program there. Were you able to... What was the school? OSU Lima. What year would that have been? 2004. Were you able to complete the nursing program at OSU Lima in 2004? No. What happened? I ended up getting deployed to Hurricane Katrina, and then I ended up getting deployed to Iraq in 2006 as well. All right. After your service, sir, were you able to return home and start your education back up again? Correct. What year was that? It would have been 2007. All right. And where did you go to school in 2007? I actually applied to Rhodes State, which is a RN program in Lima, right next to the OSU Lima campus. Took a semester there, ended up getting accepted into Hondros School of Nursing here in Columbus. Went there for a semester. It was kind of a mess. It was the very first program. It was a brand new program. They just started it. And then I applied to multiple nursing programs in Columbus, and I got accepted to Mount Carmel School of Nursing. It was a bachelor's program. So then I ended up going to Mount Carmel School of Nursing after that. What year was that? 2009, I believe. Okay. And were you able then to complete in 2009 your nursing degree from Mount Carmel School of Nursing? No. What happened after that? I ended up getting deployed again to Iraq in 2009. Okay. And how long were you in Iraq for the second time? Just about a year. And when your service was done after your year deployment in Iraq a second time, were you able to come home and then pick up your education again? Yes. All right. And then what happened? And then I was finally able to finish my degree in nursing with a bachelor's in 2013. All right. So tell us about your education at Mount Carmel School of Nursing regarding where you did your preceptorships, where you did your rotations. Where was that all done at? It was all done at Mount Carmel's system, other than I did do a critical care rotation at Grant in their ICU. All right. And you graduated in 2013? Correct. And then did you thereafter take a test to become a licensed nurse in the state of Ohio? Correct. And did you pass that test? Yes. All right. And did you get a job in nursing in 2013? Yes. And where did you get that job? Mount Carmel West on 3 Tower. It was like a med-surg oncology / palliative care unit. And how long were you there? Just over a year. All right. And what kind of work did you do in the oncology palliative care floor in 3 Tower? Typically, we'd take patients right after their surgery, whether it was bladder cancer, ovarian cancer, what have you, but it was all oncology specific. But then we also had a wing for palliative treatment as well. Typically, they didn't have the new grads go in there until they were more experienced. But then that was for the palliative care unit was strictly for comfort care when members were the DNRCC and the family just wanted to provide comfort care in the hospital setting. So you had some experience with that? Correct.
Can you just slow down just a little bit?
Oh, sorry. Okay.
I completely forgot where I was.
So you had some experience with that?
Yes, he had some experience dealing with comfort care and palliative patients.
With palliative patients, yes.
Talk about the care you would provide to the palliative patients in that year of experience.
Typically, you would do vitals once a day or every 8 to 12 hours. You just basically provide comfort, which was turning them, you would have limited treatment, essentially. They would be on nasal cannula oxygen. Sometimes you give antibiotics.
Slow down, she's writing this all down. You talk very fast.
Sorry. But it was the main support was to keep them comfortable. So basically why they were in the hospital was because they couldn't keep the pain under control while they were at home. So that's why they came to the hospital in that palliative care unit, so we could keep a closer eye on their pain levels. So we give sublingual pain medication typically, or IV pain medication for that.
Okay. So you're no longer trying to cure them of disease, you're trying to treat their symptoms while they're actively dying.
Correct.
So after a year of that, did you switch jobs?
Yes.
What job did you switch to?
I went to the ICU at Mount Carmel West.
So what year was this?
2014.
Okay. And besides your rotation in nursing school at ICU Grant, had you had any experience in an ICU setting as a nurse?
No.
So 2014, tell us about any orientation or training you received to become an ICU nurse at Mount Carmel West.
So typically that training involved 8 to 12 weeks. I think mine was 8 since I was a nurse prior. And then, so then you would be attached to a preceptor. So I was the preceptee, and I would basically shadow that nurse, and they would show me the ropes of the ICU. They try to have the same preceptor for every preceptee, but with scheduling and everything else, we sometimes would have a lot of preceptors during that 8 to 12 week period.
Would you precept on both the day and night shift?
Usually, yes.
All right. So you had experience with some of the daytime doctors, Dr. Ralston, Dr. Moody, et cetera?
Correct.
And did you have experience then also in your preceptorship with some of the nighttime ICU doctors?
Correct.
And who were they?
Dr. Husel and Dr. Hagris.
All right. So at the end of this 8-week preceptorship, what happened next?
I started working full-time as a nurse in the ICU.
What type of work would you do as a full-time nurse in the ICU? What shift would you work?
I generally work night shift, and Mount Carmel West, their ICU was an everything ICU. So you would have cardiac patients, neuro patients, trauma patients, whatever have you. It was whatever you were assigned to that day.
All right. And did you work continuously from 2014 till 2013 as a nighttime ICU nurse?
From 2014 to 2018, I worked full-time as an ICU nurse.
And the night shift at the ICU at Mount Carmel West?
Correct.
All right. And who were the doctors that you worked with primarily during that work?
Dr. Husel and Dr. Hagris.
All right. Did you feel you worked with one more than the other?
I think I remember saying that Dr. Hagris, he went to Egypt a couple times, so he would take extensive periods of absence, and Dr. Husel would cover those shifts. So I'd say I probably worked with Dr. Husel slightly more, just because when Dr. Hagris was on those trips, Dr. Husel would cover those.
All right. Tell us about your experience with Dr. Husel as far as training and interactions you would have with him.
Dr. Husel, he was a great asset, great resource. We always looked up to him, asked him questions. He had a good rationale behind his answerings. He was very aggressive with the treatment. As I mentioned, well, not before, but in my hearing previous to this, Dr. Husel was typically a little more aggressive with treatment than Dr. Hagris. So if a patient, their blood pressure was borderline a little low, Dr. Husel would want to put the arterial line in so we could keep a better eye on their blood pressure, where Dr. Hagris would kind of just wait a little longer before putting in an arterial line.
What about the experience level? What was your observation of the experience level of the other nurses in the ICU?
It was a pretty young unit.
Can you elaborate on that further?
They just generally hired a lot of new grads. just to help get with the staffing up where we needed it to be.
All right. And did you ever observe Dr. Husel helping them and training them in the ways of the ICU?
Dr. Husel helped train everybody that came to the ICU, whether they were a new grad, experienced nurse, or even like as myself, once I became more experienced nurse, he would still help and educate.
All right. At some point, did you become a charge nurse?
Yes.
And tell us about what a charge nurse is and what training you received to become a charge nurse.
So a charge nurse kind of helps supports the other nurses in the ICU. You're kind of the go-to resources that the nurses go to. And you also admit assignments for the oncoming nurses for the day shift, for the appropriate acuity and the level of care that a nurse can provide for that patient. And then what was the second part of the question?
How much experience did you have when you became a charge nurse, and what training did you receive to become a charge nurse?
Basically, to be a charge nurse, you'd have a certain amount of experience working in the ICU that would trust you enough to hold that position. Sorry. But they wanted you to be experienced enough so you can handle that position. And then after that, it was a 3-day orientation with a charge nurse. And then I was a charge nurse.
When you say a 3-day orientation, what did that 3-day orientation involve to become a charge nurse?
So I worked with another charge nurse for 3 shifts prior to being on my own as a charge nurse.
Okay. Watch what he or she did as a charge nurse, and then you were good to go.
Correct. Get the ropes and go with it.
What year was this that you became a charge nurse?
I believe it was 2015.
All right. So even though you're older at this point, chronologically, and thank you for your service, because you did 3 separate tours after high school. As an ICU nurse on the night shift in the ICU, how many years experience did you have when you became a charge nurse?
About 2.5 years.
So 24 to 30 months?
Correct.
And then a 3-day shadowing, and now you're a charge nurse?
Correct.
Okay. Do you remember the date of July 15th, 2018?
I do now, yes.
You do now, right?
Yeah.
All right. And do you now remember a patient by the name of Troy Allison?
Yes.
All right. Prior to all of this happening, did you have any particular recollection or anything stand out about that to you in your mind prior to December of 2018?
Yeah, I do remember that patient just because he coded multiple times, then he came to the ICU. He was a bigger guy, so okay. I do remember him.
So you do have independent recollection, but has your recollection been refreshed by reviewing the medical records and what happened in December and onward of 2018?
Correct.
Okay. So based on your memory and based on your refreshed recollection, tell the ladies and gentlemen of the jury about Troy Allison and your involvement.
Okay. So after reviewing the medical records, basically Troy Allison,
Go ahead.
he had a past medical history of hypertension, diabetes. He was morbidly obese. He was non-compliant with his medications. He came in to, the family called the squad because he was thirsty, urinating a lot, throwing up, and was weak. When the squad got to the ER, I believe he had a tonic-clonic seizure, which is basically a full body seizure for 1 to 2 minutes. I believe they gave some Ativan to treat that, and then shortly thereafter that, the patient coded. They gave some life-saving medications, got him back, and then shortly after that, he coded again. He was coded multiple times. I guess he was going in and out of getting a pulse. I don't know how long that time frame lasted, but he did regain consciousness or a heart rate throughout that time, but they coded multiple times. After they, once again, gave him several life-saving medications, they started him on a Levophed or norepinephrine drip to help keep that blood pressure up. And then they were able to get a CT of the head, and then they sent them up to the ICU.
Okay. Everything you just described, were you present for any of that?
No.
All right. Is that all from your review of the medical records since this all happened?
Correct.
All right. When he came up to the ICU that night of July 15, 2018, were you aware of that history you just described?
I don't know about his personal history, but I do know that he coded multiple times because as a charge nurse, if you hear a code, especially in the ER, well, any code in the hospital, they're going to come to the ICU after that. They coded him. I might have reached down to the charge nurse down there and say, hey, do you think this patient's going to make it? I can't recall the exact situation, but I prepared a bed in case we would have to get that patient. So I do recall the situation.
So you knew that he was coding in the ER. You had a patient coding in the ER. He did make it. He comes up. What's his condition when he comes up?
He's in critical condition.
All right. Was he actively dying at that point?
His blood pressure was maintained by the levofed, but he wasn't actively crashing at that time.
All right. Do you recall his condition or how you described his condition at a prior hearing?
I stated that I don't believe he had any neurological responses, such as a cough or gag, but he was on that levofed.
Do you recall saying that he was stable?
Correct. Critically stable.
Critically stable. A very sick person, but stable.
Correct.
And is that your testimony today that looking back on this, Troy Allison was stable, critically stable when he came to your ICU on July 15th?
Correct. He wasn't actively crashing at that time.
Okay. Did you do any physical examination of him when he first came up to a bed in the ICU?
Not that I recall.
All right. What happened next?
So once we knew the patient was super sick because they coded multiple times in the ER. So one of the things I like to prioritize is once we get the patient to the room, hooked up to the monitors, I always like to bring family in just because if the patient's that sick in the ER, they typically don't get time with the family. So once we got him hooked up to the monitor, got him presentable, I went out and got the family and brought him back to see the patient.
All right. What happened next?
I believe Dr. Husel was waiting on the family in the patient's room to kind of go over the medical picture of the patient, just to discuss how they wanted to further treat the patient. One of the concerns in the ICU is code status, and you always want to clarify with the family how the patient would want to best be treated, knowing that the patient already coded multiple times. Do they want to continue as a full code and continue to treat him with all means necessary, continue to do chest compressions, give life-saving medications, or do they want to change them to a DNR CCA? Essentially, you would do everything possible, but if their heart would stop, then you would go ahead and just withdraw care, or would you want to make them a DNR CC and just withdraw the life-saving measures now and try to keep them comfortable?
Okay. So this is, because it's your priority for the patient's family to see him right away. This is right away, as soon as he's in the ICU, this is the conversation you witnessed Dr. Husel having with the family.
Correct.
All right. And do you recall Dr. Husel discussing the intermediate steps from full code, DNR CCA, DNR CC?
I don't know if he used the actual terms of full DNR CCA or DNR CC, but I'm sure that he went over the actual, like, how do you want to move best forward with the patient? Do you want us to continue full treatment or continue care after his heart stops, or just provide comfort care now?
All right. Do you recall at a previous hearing saying you don't recall him saying, describing that intermediate step?
Okay. Let's rephrase.
What, if anything, do you recall specifically about the conversation regarding DNR CCA?
I don't recall specific what he talked about at that time. So I don't know if he specifically said the DNR CCA status or DNR CC status.
All right. Did you document this conversation in any way in the chart?
I did not.
Was he your assigned patient?
He was not.
Why are you there then in this conversation if he's not your patient?
So in the ICU setting, you're going to have super sick patients, and if the sicker they are, the more hands on deck, the nurses help out, especially as a charge nurse. That's kind of my go-to role, is if there's a super sick patient, I go help assist.
Okay. Do you recall who was the assigned nurse to him?
It was Tyler Rudman.
All right. So what happens after this conversation you witnessed Dr. Husel having with the family regarding his code status?
I believe I went back to charting her to the nursing station.
What happened next?
The family came to us to ask for the withdrawal.
Okay. What happened next?
I discussed it with Dr. Husel and Tyler Rudman, And then I went ahead and Dr. Husel gave me the order for the fentanyl medication. I drew it, and then we went in and did the palliative withdrawal.
All right. And what was the dose and manner of that order Dr. Husel gave you?
It was 1,000 micrograms fentanyl, IV push.
Meaning not in a bag hanging there to be titrated, but all at once.
Correct.
All right. Do you recall the unit dose size that was available of fentanyl in the Pyxis machine in the ICU in Mount Carmel West in 2018?
I believe each vial held 100 micrograms of fentanyl.
Okay, so how many, to fulfill Dr. Husel's orders, how many of those vials did you have to withdraw from the Pyxis?
It would have been 10.
And in what manner did you withdraw this from the Pyxis regarding, was this a written prospective review by the pharmacy, or did you do it in some other way?
That was VA override from the Pyxis.
All right. And was this a common practice to withdraw medicine from the Pyxis via override?
Correct.
And who taught you that?
I was kind of the standard on the floor. If you needed the medication, you pulled it.
And why were you withdrawing this medicine for a stable patient via override at this time?
Objection, misstates the evidence in question.
Okay. I'll permit the question. Overruled.
So the reason why we have pain medication, we use pain medication for every palliative withdrawal. And you always look at the critical or the scenario of the patient. This patient, he was a large patient. He was coded multiple times. I believe the chest x-ray didn't show any active fractured ribs. But when you're...
Slow down. The chest x-ray, what?
I believe there was a chest x-ray. It did not show that he had broken ribs.
Okay.
But after doing chest compressions for an extensive period of time, you're going to have pain. His lactic acid level was elevated. I believe it was 15. So it's kind of like when you run, you're going to have a buildup of lactic acid, you're going to be sore. So his was 15. The normal, I believe, is anything below 2. So his lactic acid was sky high. So he's going to be in pain. He's going to be sore. So you actually want to give the pain medication so they can be in less pain, so they can breathe more effectively. So his
I'm going to stop you there. Who taught you all of that?
most likely probably Dr. Husel.
Okay. So had you had previous conversations with Dr. Husel about his dosing habits?
I know that he gave 1,000 micrograms of fentanyl previously to mine.
Okay. Do you recall having a conversation with him at some point regarding his dosing habits during palliative withdrawals?
Not that I recall.
Had you ever given a 1,000 microgram dose yourself to anybody, either in palliative, in your work with palliative ward for a year, or previous in the ICU?
Not that I recall.
To the point, though, why did you get this on override versus a written or prospective order?
The family was ready to withdraw care. They already went through a lot. They had to hear that their husband or loved one was getting coded multiple times. They were going through a lot of pain. So when they were ready to withdraw, I went ahead and we started the procedure.
In your mind, was this an emergent situation or an emergency?
I thought it was more of an urgent situation since the family was ready to withdraw care.
Okay. So it was urgent because of the family, not because of the condition of the patient.
Yeah, we just wanted to provide, we didn't want to delay care for the patient. That was the family's wishes, and just in case the patient would code again, that's why I went ahead and withdrew the medication.
On override.
Correct.
What would have happened? What was your experience with getting the medication prospectively or through a written order that pharmacy would review ahead of time? How long of a delay were we talking here? In your experience?
It's hard to tell, especially on night shift. It just depends if the pharmacy was busy or not, but I couldn't recall.
You couldn't estimate?
I don't know. Sometimes it would be quick, sometimes it would take a while, but I couldn't give you an exact time, to be honest.
And it was the practice on the night shift just to go get the medicine when you were ordered to do so?
If you thought it was an urgent situation.
I'm sorry, say that again.
If you thought it was an urgent situation.
All right. So you got the 10 vials out. What did you do next?
I drew up the medication, and then me and I believe Tyler was in the room, and we performed the palliative withdrawal.
Describe how you drew up the medication for the jury.
That would have been IV syringe.
So they come in 100-unit doses. You have 10 of them. How did you physically have to put that in an IV syringe?
You take a blunt needle and attach it to the syringe. You draw the medication out, and then you then you take the blunt needle off, and then you give it through the IV.
Do you do that 10 separate times, or do you draw all the medicine into one big syringe?
Typically, you draw it up however many you can fit in a syringe. Most likely, you probably use 2 syringes, and then I would give that to the give that to the patient
And how would you, where physically on his body would you give that to the patient?
through the IV.
And describe how long it takes to give an IV push, or how long it gave to give this IV push to Mr. Allison.
I couldn't recall how long it took me to push it, but not very long.
Typically, how long, or how are you trained to give an IV push?
Depends on the medication. Sometimes some medications you actually want to push slowly because they can actually have they basically cause pain or irritation in the vein. So I don't know if I push this one quickly or push this one over time. I can't recall.
What was your training regarding fentanyl and the dosing, the appropriate dosing for fentanyl?
Minimal.
Well, describe minimal.
No, just bedside experience.
Okay, and your bedside experience was informed by who?
Dr. Husel and Dr. Haggers.
When you're pushing this medicine into him, has he been physically extubated yet? Has the endotracheal tube been removed, or was this done prior?
You always want to give the medication prior to doing that because that's what's going to cause the pain.
All right. Are you aware of whether Mr. Allison had received any pain medication at all during his visit to the hospital up to this point?
Not that I was aware.
All right. Were there any charted pain scores for Mr. Allison in this hospital visit at all?
I don't believe there was.
Did you chart any visible signs of pain and or chart a pain score for Mr. Allison when giving him, or after giving him 1,000 micrograms of fentanyl?
I did not.
And what is the purpose of fentanyl?
Pain relief?
But you did not chart anything?
I did not.
Did you observe anything?
I can't recall how long I was in the room. I know typically with palliative withdrawal, you try to treat the patient and then leave sooner than later so the family can have that time with the patient.
Prior to or as you're giving the medicine to him, do you recall observing any physical signs or other signs of pain that Mr. Allison was in?
Not that I recall, but like per my previous statement, I don't think he had a cough or gag. So his neurological status was limited.
And that he was unconscious.
Correct, he was non-responsive.
What happened next?
We withdrew care.
While you gave him the medicine and you withdrew care, what does that mean? Tell physically what happened. Tell the jury what you remember happened.
Okay. So after you give the medication, like I said, preemptively before you actually
Okay,
do
let's slow it down a bit.
Oh, sorry.
Okay?
Okay. So after you give the medication, preemptively, prior to extubating, I gave the medication, and then you would actually take out the endotracheal tube, and then I don't know if they had an NG tube, probably, because I believe he had coffee ground emesis. But so you would take out the endotracheal tube, and then the OG tube, and then suction them as needed. You'd usually put 2 liters nasal cannula on them, just for comfort. Nasal cannula, or 2 liters of oxygen per nasal cannula, excuse me.
And then you said you left the room?
Correct.
And was the family present in the room to your memory?
Once we left, I'm pretty sure they were there,
Where did you go?
in the nursing station.
How far away is that from Mr. Allison's room?
It was pretty much right next to the bed.
What happened next?
I believe the patient passed away.
Do you recall how long that would have been?
Per the documentation, it wasn't very long.
What happened next?
The family told us that they didn't need anything, and I believe they talked to the chaplain sometime, I think it was after the fact, because the chaplain would help arrange funeral arrangements, things like that. But then family left, and then we cleaned up the patient, brought him to the morgue for morgue care.
All right. And did that conclude your involvement in the care of Mr. Allison?
Pretty much.
All right. So that was in July of 2018. Do you remember being questioned by the police in December of 2018 regarding this?
I do.
And did you speak with the police?
I did.
All right. Did they specifically have Mr. Allison's chart and or name or any other real information about that?
They didn't at the time.
Okay. Thereafter, was your employment affected at Mount Carmel in December, January 2018, going into 2019?
Yes, I was put on administrative leave in December of 2018, and then I was terminated in the summer of 2019.
Were you referred to the professional nursing board?
Objection.
Sustained. Go sidebar.
I've been asking this question all the way through.
I understand. We're not doing it live, we're doing it over here. Schaefer?
What, if any, oh, I apologize.
I apologize. I thought you had it together there. My assumption, sorry. I sustained the objection. Question.
Okay. And without further elaboration, what, if any, referral was made regarding your license to practice nursing in the state of Ohio? Were you referred?
To the nursing board?
Yes.
Yes.
Okay. And you said were you terminated from, or what happened with your employment at Mount Carmel after this incident?
I was terminated, and I left the hospital and obtained a different job.
Are you still able to work in nursing at this point?
Correct.
Thank you. I have no further questions.
Mr. Baez?
May it please the court. Mr. Zion. Good morning, ladies and gentlemen. Good morning, Mr. Schultz.
Morning.
First off, from one vet to another, thank you for your service.
Thank you.
Now, you were working at the ICU for approximately 5 years, correct?
The ICU, I believe, was 4.
4, okay. And prior to that, you had some palliative care experience.
Correct.
Now, in the palliative care floor, the patients aren't actively dying at that time, correct?
They have a terminal disease, so it depends how long that disease process takes. So
Right, so to classify it as actively dying, it's really subject to interpretation based on where they are in the stage of their disease, correct?
correct.
Okay. Now, having said that, you first got called upon this case when the police came to speak to you at Mount Carmel, correct?
Correct.
And did the hospital get you a lawyer?
Not at the time, no. No, they never got me a lawyer.
Okay. And you didn't feel you had a lawyer that you could ask questions to while they were questioning you, right?
So I talked to a lawyer before I talked to the detectives, but they didn't come in the room with me.
Okay. And subsequent to that, did you ever feel you had a lawyer?
Not from them until the civil case.
Okay. Now, until the civil case, and that's when you had a lawyer?
Correct.
At the hospital?
Correct.
Okay. Now, in light of that questioning by the police, they didn't ask you anything about Troy Allison, right?
They didn't know the specifics at the time.
In fact, they only asked you general questions about medication, right?
Correct.
And you didn't give them anywhere near the amount of information that you gave here today, right?
Probably not.
Okay. Now, you talked about training and in the ICU. I want to talk a little bit about that. Dr. Husel, would you say Dr. Husel was very accessible to all of the nurses on the floor?
Yes, very much.
Not just the male nurses, but the female nurses too?
Correct, all of them.
Okay. Not just the younger nurses, but the ones that were more experienced as well?
Every nurse there, yes.
And that's because he had the benefit of going to medical school where the nurses did not?
He had a lot more knowledge and education than we did, yes.
And he also had his residency at the Cleveland Clinic,
Yes.
which is held in high regard.
Yes.
Now, this training, did you believe it to be to benefit all of the patients that came through the ICU?
The education from Dr. Husel?
Yes.
Yes.
And that was so that the ICU team could give better care to everyone, right?
100%.
Okay. And if you ever had a question about anything, did you feel you could come to Dr. Husel?
Yes.
And if Dr. Husel ever gave you an instruction or something that you weren't sure about or had any issues with, did you feel comfortable enough to question him on it?
Yes, even during code situations, Dr. Husel would ask, does anybody else have any suggestions at this time? So he was definitely open for suggestions.
So he wasn't the type of doctor who would just bark orders. He was actually someone that would be open to discussion.
Correct, 100%.
And did you find that he would listen to suggestions?
Yes.
Now, you testified under direct that you also had a preceptorship, correct?
Correct.
And a good chunk of your training also came from working with other nurses, right?
Correct.
And you would learn from these other nurses based on their experience?
Correct.
Okay, and in fact, would you say you got more training from other nurses, more experienced nurses, than you did from Dr. Husel?
I would say, during the preceptorship, that was the main role of the nurse preceptor, is to train the new nurse. So you always want to gain knowledge from every resource around you. So whether it was pharmacy, the experienced nurses, or the physicians at night, you always wanted to reach out for your resources. So I would say, as Dr. Husel's, one man, we had multiple resources. Well, working night shift, we had minimal resources compared to day shift. We still had resources for that information or knowledge.
But you had nurses there that had been there for 30 years, right?
Probably, correct.
Like
Long time. Yep, they were there.
Okay, and you also had nurses that had been there for 15 years as well?
Correct.
Okay, so did you consider these nurses resources?
100%.
Okay, and some of the things that you would talk to them about would of course be palliative extubations, right?
Correct.
And what type of doses they had, correct?
I don't know if we talk specific dosing, but we would definitely talk patient-specific information.
But it was never a secret that Dr. Husel gave doses and the dose amounts that have been in question in this case, right?
No, it was not.
Okay. And in fact, you're also aware, by working there, that the pharmacy was also aware, correct?
Correct.
Okay. And did you ever witness Dr. Husel attempting to hide these dose amounts in any way?
No.
Okay. In fact, many of them would be written in the, actually all of them were written in the medical records, right?
Correct.
Okay. Now, I want to talk briefly. Actually, you also received some training in palliative care while you worked in that department, right?
Correct.
And also on terminal extubations as well?
Not terminal extubations. We just received specific care for palliative/comfort treatment, but we never had specific training for the withdrawal of a ventilator or withdrawal care.
And based on your training and experience, what's the purpose of comfort care?
Comfort, it's pain relief. So keep the patient as comfortable as possible.
And in part of that on the job and also training that you got through your preceptor experience, did you learn about the doctrine of double effect?
Yes.
Okay. And so what is your interpretation of the doctrine of double effect?
Your Honor, I object.
Sustained.
Now, let me shift over to Troy Allison for a few moments. You said you remembered him independently as well, right?
Correct.
And you remembered the conversations with the family?
Correct.
Okay. And Troy Allison's wife, do you recall her? Do you remember her?
Yes.
Okay. I'm going to show you Defendant's Exhibit TA-8. May I approach, Judge?
Man,
Do you recall if that is Troy Allison's wife?
I believe.
Does that refresh your recollection as to who we're talking about?
That would make sense, yeah.
Okay. May I publish, Your Honor?
any objection?
I would object to this, Your Honor, as to its relevancy and/or the witness says he believes it would make sense. I don't think he actually identified that as Troy Allison's wife.
He did identify her as.
But I will stipulate that's a picture of Troy Allison's wife, but Judge, I don't see the relevancy of this. I've published
Okay,
this to the
you can publish.
Just so we know who we're talking about. Thank you, Judge.
Just give it a second.
Okay. All right, so I'm showing TA-8 again. Now, this would have been the person that you had the conversation with as it relates to end-of-life care, correct?
Dr. Husel had a discussion with. I was just present.
Okay. So in light of that, let's talk about that for a moment. Now, there was the prosecutor asked you, through his question, that Mr. Allison was stable, and you corrected him and said critically stable. You recall that?
Correct, yes.
Why did you make that distinction?
So just because the patient's in the ICU and they're not actively crashing doesn't mean they're stable, just for the fact that there's different levels of acuity. Obviously, in the ICU, they're going to be acutely ill, but they can also be incredibly acutely ill. That's why you have different nurse-to-patient ratios. And this one, I don't know if it was a 1-to-1, but he was very critically ill.
In fact, you called him super sick, right?
Correct.
And you, in fact, knew about his condition before you even got to the ICU because it was your job to be alert as to cold blues happening within the hospital, right?
Correct. And I had to have a decent understanding of the patient so I can assign the appropriate nurse to that patient's care.
So once a patient gets to the ICU, you said you brought the family in because you want to know how to proceed with their care, right?
Essentially, yes.
And it's important for you as as the charge nurse to understand what's going on with the specific patients that you may have to supervise within the ICU, correct?
Yeah, the sicker they are, the more involved I am with the patient.
Okay. So, and this would have been one of those patients that were so sick that you needed to be involved?
Correct.
Okay. So, when I want to talk about two different scenarios, and you can tell me which scenario Mr. Allison fell in. There are patients that sometimes are on life support that their conditions start to die immediately, correct?
Correct.
And they are in danger of dying while on life support, correct?
Correct.
There are patients like that? Okay. And it's at that time that sometimes family discussions are held, right?
Correct.
And then there are the patients that when they arrive at the ICU, sometimes families make that decision that they don't want to be on life support. They don't want their loved one to be on life support, correct?
Correct.
Would you say that Troy Allison fell under the latter of those two scenarios?
He wasn't actively crashing, but since he was so critically ill, that's why we always like to have those discussions up front in case they would actively decline quickly.
Now, it came to your attention that the family, well, you testified on direct that after understanding what his condition was, that the family came to you and told you that they wanted to take him off of life support.
That was my understanding, yes.
Okay. Now, during the conversation with the family, did you believe that Dr. Husel's explanation was accurate as to Troy Allison's condition?
Yeah.
Your Honor.
Okay. Sustained based upon the question, rephrase.
Sure. Did you hear Dr. Husel give Troy Allison's family any inaccurate information as to Troy Allison's condition?
Okay. Sustained, rephrased.
Was the conversation, without telling us what he said, was the conversation with Troy Allison's family by Dr. Husel thorough, in your opinion?
Objection, Your Honor.
That will not permit.
I believe what Dr. Husel explained to the family was a full picture of what was going on with the patient.
Okay. And did he give percentages as to whether Troy Allison would live or die?
Objection.
Sustained.
Did you in your training and experience, in your training experience, let me strike that. Have you heard Dr. Husel speak with families before about terminal extubations?
Yes.
Okay. And have you ever heard him give percentages as to whether someone is going to live or die?
Objection, Your Honor.
Sustained.
Was there ever any discussion about brain death?
Not that I recall.
Okay. And if Dr. Husel stated something that was incorrect about Troy Allison, would you have corrected him?
Yes.
Did you feel comfortable enough to correct him based on your relationship with him?
Yes.
Okay. Would you have, if Dr. Husel failed to give pertinent information to the Allison family, would you have supplemented the conversation?
If I knew that they weren't aware of something, I would inform them, yes.
Okay. And did you have to in this case?
No.
Now, Mr. Allison's lactic acidosis was at 27, correct?
Oh, was that high? I thought it was 15, but it might have been.
Okay. What about his pH levels? They were at 6.5. Do you recall that?
Correct.
Okay. Is that sustainable with life based on your training experience?
No.
Okay. And Mr. Allison was obese as well, correct?
Correct.
Weighed over 300 pounds?
Yes, he was a large man.
Okay. Was a very big guy.
Yes.
Okay. And I recall your questioning about the vials and how you drew it up and how many vials. Based on your training experience, have you ever had a doctor order medication based on the number of vials?
No.
I'm sorry?
No, it's milligrams. It's per dosing recommended, not vial.
So, for example, either micrograms or milligrams?
Correct.
Okay. And 1,000 micrograms would be equivalent to 1 milligram, correct?
1 milligram of what?
I'm just giving the metrics. A milligram is what?
Oh, correct. Yes. 1 milligram is 1,000 micrograms. Yes. Sorry.
Okay, so we're talking one and the same.
Yes.
Got it. You can have just one moment, Judge. I want to make sure. If I could have just a moment, Judge.
Amen.
Sorry, there's a couple of questions I wanted to ask you. Mr. Schultz, if a patient's chest were to become stiff while being on a ventilator, and they were unable to breathe, basically, would an alarm go off on the ventilator?
Yes.
Okay. And that's also something the nurse looks for, correct?
Correct.
Okay. And so when a patient's on the ventilator, the nurse says that you don't just let them be, you actually monitor what's going on, correct?
You have to assess the situation and inform the doctor and get treatment for it, yeah.
Okay. And in addition to that, during a terminal extubation, after a patient gets medication, they're still monitored, right?
Correct. We leave him on the monitor even during the withdrawal.
So you just turn off the audio alarms inside the room, correct?
Correct. There's a monitor in the room and outside the room in the nursing station, and we just basically shut off all the alarms so the family member is not aware of what's going on with the patient, and it's just a blank screen.
Okay. And you took me to my next question. And basically, what a nurse does afterwards is they give the family privacy with their loved one, and they go to the nurse's station where they can monitor the patient's vital signs there, correct?
Correct.
And that's attached to a computer, or you see it on the screen.
Correct.
Now, would you describe the culture at the ICU as one? Are you familiar with the culture of the ICU, being there for 4 years?
Yes.
Okay. Was it one of camaraderie and teamwork, or a family? How would you describe it?
We were a very tight-knit group. Coming from the military, it's almost like if you overseas, you have your band of brothers, you're very tight-knit because you're in a very difficult situation. Working in the ICU, I would say it's a similar situation. We deal with very critical patients. We deal with a lot of stress from families, patients, everything else. So you have to have a tight-knit group to work effectively, especially in our ICU because it wasn't everything ICU. It wasn't just cardiac. Like, I believe Mount Carmel West is one of the only ones, well, it's not there anymore, but having an everything ICU, there's doctors in every specific field for cardiac, for neuro, for trauma. As a nurse, they expect us to treat all these, or not treat, but help maintain and assess these patients for every type of patient. So it was impossible for one nurse to know everything about every different disease process. So we had to be a tight-knit group because we had to rely on each other for every disease process within that ICU.
So you wouldn't describe it as an environment where there were romances and bullying going on, would you?
It was a very tight-knit, family-type group.
Okay. Now, you testified earlier about the pharmacy being aware of the doses. You had, in fact, seen the pharmacy approve these dose amounts with Dr. Husel, correct?
On previous occasions, yes.
Okay. And it was, in fact, as the charge nurse in charge of Mr. Allison's care, it was, in fact, your intention to provide comfort care for Mr. Allison, was it not?
Correct.
And it was your intention to alleviate the painfulness associated with the dying process.
Yes.
It was never your intent to hasten Mr. Allison's death, was it?
That would never be my intent.
Okay. And as far as you know, if you were to ever see if you had seen another nurse or another healthcare professional doing something like that, you would have, of course, spoken up.
Yes.
No further questions.
Feedback?
Let's start at the end there. That last question. As far as you know.
As far as I know is what?
Remember, that was the last question. As far as you know.
I would never hasten death?
Correct.
I would never hasten death.
As far as you know.
Objection, Judge. Leading, and I can only ask him about what he knows. I can't ask him about what other people know.
I understand the objection. Rephrase.
That phrase is what I'm asking about.
I would never want to hasten anybody's death.
Not that phrase. As far as you know.
Objection, Judge.
I want to ask you about that question.
Okay. You don't have a question yet, but
Well, I keep objecting. So that phrase, as far as you know, your knowledge, where does it come from regarding fentanyl and the appropriate dosing during palliative extubations at the nighttime of the ICU?
Would have been my experience in the ICU.
And who does that come from?
From the nurses and the doctors.
Objection, Judge.
I'll permit it.
From the nurses and the doctors I work with.
Did Dr. Hagrish use fentanyl during palliative extubations?
I don't think typically no.
Who used fentanyl during palliative extubations?
Dr. Husel.
And who taught you extensively in the ICU about things, about everything?
All the doctors, but yes, Dr. Husel.
So your knowledge, meaning that question I asked about as far as you know, comes from Dr. Husel regarding fentanyl and the appropriate dosing.
Most of it.
Objection, asked and answered.
Sustained.
Is it your testimony that when you worked in palliative care, which you described as people that are dying, that can't control their pain at home, come to the hospital to receive care, those people were not actively dying?
So the dying process is different with every disease process. So just like with hospice care, you can be, in order to be in hospice care, you have to be terminally ill and expected death within 6 months. So just because you're expected to die in 6 months doesn't mean you're going to die in 6 months. You could die in a week or you could die in a year. So it's always hard to tell with every disease process. Every patient's different.
These people are not being treated, though, for their underlying diseases at this point.
Correct.
It is comfort care at that point.
Correct.
And in your year in palliative care at Mount Carmel, did you ever administer anybody 1,000 micrograms of fentanyl to relieve any pain they were in?
I did not know.
Talked about your knowledge of Dr. Husel's training and experience. Where did he go to school?
All I knew at the time was that he went to Cleveland Clinic
And
for anesthesia.
And what is the reputation in your mind of Cleveland Clinic?
They're a great hospital system.
Where did Dr. Haggis go to school?
I don't recall.
Where did Dr. Moody go to school?
I don't recall.
Where did Dr. Ralston go to school?
Objection, beyond scope.
I don't know.
Okay. I'll permit it since it's going on the subject.
In regards to Dr. Husel's, your perception of Dr. Husel's knowledge, do you recall at a previous hearing talking about what your belief of what his knowledge was on all things ICU?
Objection, beyond scope.
Is not beyond the scope. He
All
has the
things
specific.
ICU.
Okay. We don't do it. If you guys want a sidebar,
I don't want a sidebar, Judge.
okay. Overruled. Ask.
What was the question again? I'm sorry.
What was your perception of Dr. Husel's knowledge regarding medicine and his training in the ICU?
I looked highly up to him, and I thought he was very knowledgeable.
Okay. What amount of resources did you have on the night shift in the ICU, working third shift?
As I mentioned before, on night shifts, you do have limited resources compared to day shift. Not all the different doctors or attendees are around. Typically, the only doctors in-house are the CIC, there's some residents. I guess there's a bunch of different types of residents. There's trauma and everything else. But there's typically either Dr. Husel there's either Dr. Husel or Dr. Haggis in the ICU, and then another attending physician covering for the rest of the hospital.
And because of this limited amount of resources regarding doctors, do you rely heavily on the expertise of that doctor you're working with?
Objection, leading.
Sustained. Rephrase.
To what degree do you rely on the expert physicians that are given to you?
A lot.
Were you aware at the time that you did this override and pulled medicine in that manner that pharmacy did not prospectively review, or in many cases review at all, those orders?
Objection, leading.
It's a direct question.
The second.
I understand the question. I understand the law. Overruled.
From my understanding, the pharmacist, any medication that we put in the pharmacy would review. That was my understanding at the time.
You dropped that, I'm sorry.
Oh, at the time, my understanding was that every medication that we put in, pharmacy would review.
All right. And is that why you didn't think it was a big deal to override?
Correct.
Regarding the culture of the ICU, You described it as a very tight-knit group. Did you use the word band of brothers, or did I make that, I did that added in?
I made the reference to the military just because it is such a just stressful situation. So, like, I have my immediate friends from my military background, and I still have friends from that ICU because you become such a tight-knit group.
Right. And in the military and in the ICU, did you question your leaders when they gave you orders?
If I thought they were inappropriate.
And did you question Dr. Husel when he gave you this order?
Not at the time, no.
Thank you. Nothing further.
Okay, give me a step down, thank you. Let's take 10 minutes real quick. I'm trying to gear it up on the schedule, guys. So let's take 10 minutes, let everybody a chance to stretch their legs. We'll commence after that. Remember the admonition. Ms. Schaefer?
All right.
You may be seated. Mr. Zion, anything for the record?
No, sir.
Mr. Baez?
No, sir.
Take our 10 minutes.
Judge, there is, Ms. Mick is concerned because this morning she was in the parking garage.
Yeah, there were I can tell which one.
Go ahead.
Yeah, just when I was riding down from the parking garage in the elevator, multiple people got in the elevator. I think one of them may have been a juror. I'm not 100% sure. There was like no discussion. It was just like when everyone got in the elevator, everyone said good morning, and that was really it.
And when you left the elevator?
I didn't talk to anyone.
No. You guys went in the same direction,
Oh,
different
no.
directions?
No, opposite directions.
I'm sorry?
Opposite directions.
Okay.
Yeah, and everyone had jackets on, so I'm not 100% sure. Just seeing them walk in this morning, it might be one in the back that I can't like see from my seat, so I'm not 100% sure.
Any questions over?
Judge, we need to lock her up.
So the solution from now on is lock the lawyer up? Is this what we're asking for?
No, sir.
Okay.
Thank you, sir.
Take the stairs.
Okay, thank you for telling us.
Yeah.
Any requests for inquiry of the jury?
No, sir.
Okay. Did you get that typed up? be seated. I hope you had a wonderful break. I hear you guys have been sharing Mama's cookies. They are tasty, but they're not on my diet. We'll carry on the testimony. Ms. Grubb, call your next witness.
Thank you, Your Honor. The state of Ohio calls John Burke to the witness stand.
Just real quick.
And just so you all know, Mama's cookies are Judge Schaefer's, my bailiff's mom's special cookies. Yeah.
I moved his seat just in case because he's directly facing us.
Okay. Sir, you need to raise your right hand. Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God? Go ahead and make yourself comfortable there. Okay, you got a deep voice, so you're going to have to give me a little body.
I got you.
Okay? I need you to state your name for the record and spell it in my court report.
John Burke, John Burke.
You guys hear him okay? Okay. Ms. Grubb.
Thank you, Your Honor. Good morning to the court. Good morning, Mr. Burke, ladies and gentlemen of the jury, counsel, both sides. John, are you a Central Ohio resident?
Yes, ma'am.
Thank you. Do you work in the correctional field?
Yes, ma'am.
Is it preferred by you that your place of employment not come out in testimony this morning?
Yes, ma'am.
Thank you. Who was your mother?
Frances Burke.
Thank you. I'm exhibiting State's Exhibit 6A for the record. Is that a picture of your mom?
Yes, it is.
Do you know when that picture was taken?
Within the last 4 years, it was her driver's license photo.
Was it? Okay. Thank you. Do you remember the time frame surrounding your mother's final days?
I remember the days. I don't necessarily remember like the actual times.
Okay. All right. Were you residing with your parents during
Yes.
those days? Who all was in the household?
My father, my mother, and myself.
Okay. What was the family structure when you were younger?
We were very close. You could talk to I had parents you could talk to about anything. We went out for Sunday drives, just hung out together, spent a lot of time together when we were younger.
Thank you. Did you have siblings?
Yes, I have one real brother and two half-brothers.
Okay. And were those half-brothers shared with your mom?
I believe they had a relationship. To their extent, I don't know.
Okay. But they were not your mom's children?
No.
Were they your dad's children? Or?
Yes.
Okay. And what happened with your brother?
He passed away in 2007.
Okay. Do you remember the activities of your mom the day before she died?
Yes, ma'am.
What was she doing?
She had drove down to the nursing home approximately 5 miles away to visit a neighbor that had had a full knee replacement and was in rehabilitation.
Okay. What was the level of your mother's typical daily activities?
She would read, watch TV, go for drive, visit neighbors, and talk to her sisters on the phone and her brothers on the phone.
How old was she?
73.
Who kept house?
Her and my father both. We all, and myself, we all took shares in cleaning. And
How about food preparation? Who did that?
they ate for themselves. I'm not sure who cooked, and then I ate with my own.
Okay. Do you remember the day that your mom fell ill?
Yes.
What happened?
My father had told me earlier in the day that she had tried to turn off the TV with the phone, and that was an odd thing for her to do. But he didn't think anything of it because she started acting normal after that. When I seen her later on that day, she was trying to...
Can you stop right there,
Yep.
John? When you say later on that day, what time frame are we talking about?
I think that the trying to turn off the TV with the phone was probably 11 o'clock noonish. I'd say my time frame of seeing her was probably about 5.
I'm sorry.
About 5 p.m.
5 p.m., okay. And then what happened at 5 p.m. or thereabouts?
She was trying to turn off or buy a movie on TV, and I asked her if she was okay because that wasn't normal for her to do. And she just said that she felt really tired and that she was going to go lay down. And she was looking at the table next to her, and I asked her what she was looking for. And she said a bottle of water, and there was 4 bottles of water sitting there that she could not see. And she had proceeded to get up to go to the bedroom. And at that time, I went to the garage where my father was and asked him to come in because I didn't think something was right with her. And I said she went to the bedroom, so we went toward their bedroom, and we noticed that she had went into the restroom. So he opened the door, and she was sitting on the toilet, and he asked her what was wrong, and she just started crying and said she didn't know. And he said, well, let's get you up and get you to the bed. As they got her up off the toilet, she started to slide down, and she said, I'm falling. I immediately called 911, and at that time she was not verbally responsive, but if you told her to squeeze your hands and things, she could.
Okay. And then what happened?
The paramedics came, and they took her to Mount Carmel West.
Did you see any actions of the paramedics when they came to your residence?
The only thing I seen is they tried to talk to her, and she was nonverbal, but she was squeezing their hands. They put her on the gurney and took her to the squad.
Did you follow the gurney out?
To the front door, I did, yes.
Okay, what about when they placed her in the vehicle?
No, I did not.
Okay. Then what happened?
The squad had left, and I gathered my father, and we drove to Mount Carmel West.
Thank you. What happened when you got to the hospital?
I dropped my father off at the front door, and I went to park the vehicle. And when I went into the front door of the emergency room at Mount Carmel West, my father was nowhere to be found, so I went to the desk and asked, told them who I was there for, and they gave me a badge and sent me back to the emergency department where I had seen my mother with some tubes in her mouth. But then a lady came and got me and took me to where my father was as soon as I got in there and seen it.
So let's back up a little bit. Where was your mom when you saw her with the tubes?
In the emergency room.
Was she in one of the rooms in the back, little rooms with the curtains, or?
I don't believe so. From my recollection, it was just like a open. I could have had a curtain, but it might have been open. I couldn't tell.
Okay. Was it a hallway or?
No, it was like a little room, but it was like an open area where they might have been separated by a curtain, maybe.
Okay. Where were all the tubes?
They were in her mouth that I could see.
Anywhere else?
Not to my recollection.
And your dad was where?
He had been taken to a little room by the chaplain, and that was later who I found out was the woman that came and got me and took me to him.
Okay. Did she introduce herself?
She might have to my father. To me, I just knew her as the chaplain.
Okay. And what happened then?
She said that the outcome was not very good, that she had suffered a stroke, and that they were consulting neurology because she was on Xarelto, and that there was not it was not reversible, so they to find out if they could do surgery. And she had later said that they were not able to do surgery, and
okay, stop right
Yep.
there. How was this person attired? What clothing was
from my recollection, just I believe it was a sweatshirt and just like some dress slacks.
Okay. Was there anybody around that area in Scrubs?
Not where we were, no.
Did you talk to anybody in Scrubs at that time?
To my recollection, we did not.
Was anybody there in a white coat?
I do not believe so.
Did you talk to anybody in a white coat at that point?
Not to my knowledge.
Okay. What happened then?
They told us that they were going to admit her to the ICU, and that since they told us there was nothing more they could do, we felt it best to call family.
Okay, who called the family?
I did. I called my mom, one of my mom's sisters, and I knew that she would call everybody else, and then I called a friend of mine that I was very close with.
Okay. And who came?
My Aunt Sharon, which is my mom's sister, my Uncle Roy Buckley, that's my mom's brother, my friends Chris and Jeff came for me, and there were other family members and cousins, I believe, on my mom's side that showed up at one point.
Okay. And how was your dad doing at that point?
He was very upset, just wondering how it happened like it did so quick.
How old is your dad?
81, or 80, he'll be 81.
What was his employment status at that point?
I believe he is disabled and retired.
Where did he work before he became disabled?
That I don't know. I know he worked at a warehouse at one point.
Okay. What was your dad's affect or appearance when all this was going on?
Very emotional.
What happened when you got up to the ICU floor?
We were in the waiting room, and a dark-haired nurse had come out and talked to us and told us that there was nothing more that could be done, that she was on life support. And at that time, I believe she asked me to sign a DNR. And
Asked you?
Yes. And I advised her that I was not the next of kin. That would have been my father.
Do you have any idea why they asked you?
I do not.
Was your dad standing there?
He was with some family members like several feet away.
Okay. How do you know this person was a nurse?
They had scrubs. I believe they were green.
And was there any identifying done by this person? Did they say, I'm so-and-so?
They may have at that moment. I don't remember a name.
Okay. And was a document presented to anybody?
I believe it was presented to my father.
Did you see that?
I did not.
Did you see any conversation between your dad and any other individual?
He did ask myself about the DNR.
Who?
My father did.
Okay. What did
he asked me what it meant, and I said, as far as I know, it means that they won't do CPR if she passes away. And I'm not sure if he signed it or not. I'm assuming he might have.
What was his affect when he was talking about this?
Very upset because that meant...
Objection as to speculation as to what that meant.
Okay. Sustain, let's rephrase.
The question was, what was his affect?
But he started to elaborate to other areas, so
can we
that part
just
of the
strike
question's
after very
broken.
upset?
As to what someone else was, yes, they could be stricken there. Is that satisfactory? Okay.
So, just so I understand, very upset will remain in the record, the rest will be stricken.
Correct.
Okay, thank you.
Once he started speculating as to what someone else felt or did, unless he observed it.
Thank you. Had either of you seen your mother in the room when this happened?
No.
to your knowledge, had either you or your father spoken with a doctor
No.
when this decision was made?
Okay, help me out. Okay? She got to let her finish her question. I know you want to tell us a lot, and we'll get there. Okay?
Yes, sir.
You want the question re-asked then? Or did you understand the question?
I understand.
Okay.
Okay, go ahead and answer.
We had not spoken to a doctor, to my knowledge. I knew I hadn't. I don't believe my father had either.
Okay. When did you next see your mom?
I'd say it wasn't long after the nurse talked to us about the DNR that they let us go to the room.
Okay. Then what happened?
We went to the room, the family members did, and she was in the hospital bed with tubes in her mouth, which I was told it was a ventilator. That was the nurse telling us that.
Okay. And was your mom doing anything?
When we first got in there, no. I don't know how much later it was. She did start to jerk her hand, and my dad asked me to tell the nurse because he didn't want her to jump around like my brother had when he was on life support. And the nursing station was right outside the room, so I just said, "Hey, nurse, can you come?" And the nurse came, and she said, Dad said he wanted her to be comfortable, and the nurse had left after that.
Was your mother exhibiting any signs of pain?
Not that I could tell, other than the jerk in her hand, but I'm not sure if that was.
Was there any discussion with any of the medical staff with respect to any medication that would be offered to her?
They did not say what medication, but when he said he wanted her to be comfortable, they said they could give her something to help her be comfortable and quit the jerking.
Were you left with any impression about how long she would strike that? When you went back into the room, other than the hand jerking, what else did you notice about her?
It looked like she was sleeping or in a coma, maybe.
Okay. Was she still ventilated?
Yes.
Did there come a time when you were asked to leave the room again?
I believe they did ask us when they were bringing the medication in if we wanted to leave the room or remain. And from what I recall, the only person that stepped out was my father.
Did you stay there?
Yes.
What did you see?
The dark-haired nurse came in with a needle or syringe and put something in my mother's IV.
Okay. That dark-haired nurse, man or woman?
Female.
Then what happened?
I don't know how much time had passed. My dad was holding my mother's hand, and he said that she was gone, that he could tell that.
Okay. Before she died, were you left with any impression as far as how long she would be there before she passed?
No.
How much time had elapsed between when you arrived at the hospital and when you believe that the conversation occurred with your dad regarding the DNR?
I would say, I believe a couple hours, because we were with the chaplain down in the emergency room before we went up to the floor.
How long was it, in your mind, between the time that the nurse infused the medication and when your dad said, she's gone?
I would say 10 minutes maybe.
Did anybody tell you what medicine would be given to her?
No,
Was a type of medicine discussed?
I do not believe so.
What happened after your mom passed?
My uncle, who is a minister, we prayed, and then I believe we talked in the waiting room amongst family, and then we departed the hospital.
Okay. From the time your mom coded at home until death, how much time elapsed?
I would say maybe 6 hours.
Did there come a time when the hospital reached out to you after your mother's passing?
Yes.
Tell me about that. Tell us about that.
It
What
was
happened?
right after Christmas. A Dr. Senna Emma had called the house, and my dad had answered the phone and come and got me to get on the other landline to listen. And he advised us that they were investigating an overdose of my family member.
Okay. And as a result of that, did your family secure legal advice?
Yes.
Thank you. Ms. Menashe will now have some questions for you, John.
Yes, ma'am.
Thank you.
Ms. Menashe.
Hasn't been that long. Good morning, sir.
Good morning.
Diane Menashe, on behalf of Dr. William Husel. Just want to go back a moment. You were just asked a question about from the time your mom coded to when she passed. If you know, your mom didn't actually code. Do you know that?
I don't believe so.
But she did certainly have the situation that you described in the bathroom,
Yes.
which led you to call 911.
Yes, ma'am.
But as you recall it and sit here today, there wasn't CPR that was performed on her at the house that you saw.
No.
And then the ambulance took her to Mount Carmel West
Yes.
after you placed the 911 call.
Yes, ma'am.
Just so we're sure about which floor events take place on, I'm just gonna, you drop your dad off at the first level at the main entrance at Mount Carmel West,
At the emergency room entrance.
the ER entrance.
Yes.
And then after you park the car and you come back, you walk into the emergency room floor yourself.
Yes, ma'am.
When you described the room where you first saw your mother with the tubes in, that was on the first floor of the hospital?
Yes.
So you were in the emergency room at that time?
Yes.
Where she had been intubated?
I believe so, yes.
I want to just talk to you, and I know that it's 2022, and this took place in 2018, so it's been 3 to 4 years.
Yes, ma'am.
And you described the condition of your father at the time as being very upset, but I assume, given how close you were with your parents, that this was a really upsetting event for you as well.
Yes, ma'am.
In the emergency room, so on that first floor, do you recall conversations with a Dr. Poltinas at 5:20 p.m.?
No, ma'am.
It was a woman doctor. Do you remember that?
No, ma'am.
Okay. And you don't remember any woman or woman doctor at 5:20 p.m. talking to you and your father about the life-threatening condition and the brain bleed that your mother was experiencing?
No, ma'am.
And then at 7 p.m., do you recall a conversation with Dr. Klosser in the emergency room about the inability to do any neurological treatments for your mother? Do you remember that?
No, ma'am. The only person I remember talking to us about anything was the chaplain in the emergency department.
And so then you don't remember the conversations either with Dr. Wooten in the emergency room about the critical nature of your mom's brain bleed. And just to visually orient you, Dr. Wooten was a black male. Do you remember that?
No, ma'am.
And then from the ER, you go to your mother's move to the ICU.
Yes.
And do you recall what floor the ICU was on at Mount Carmel West?
I believe it was the 4th.
And I hate to do it, but I have to. I want to talk a little bit about your brother and the situation with your brother in 2007 and just how it relates to this case.
Yes, ma'am.
Your brother died on a ventilator.
Yes.
And was there a decision made by the family with respect to your brother as to his terminal ventilator withdrawal?
Yes.
I'm going to object to this line of questioning, Your Honor.
I'm going to give her a little leeway with it. Let's tie it in.
Thank you, Judge. And here's why I asked about it, is that you and your father had a somewhat similar experience, and I don't mean to say they're the same, in 2007 with respect to your brother that you were then having with your mother in 2018, right?
Yes.
Again, I'm going to object because there's no foundation laid as far as what the brother's condition was, what happened to him, how he got to the hospital,
Overruled.
etc.
And I'll be quick with these questions. And so you were familiar when you saw the tube down your mother's throat, you knew that she was on a ventilator, is that fair?
Yes.
And ultimately when, I think you indicated the woman, and your memory is now that it's a chaplain, but that the chaplain came and talked to you that your mother's situation was that she likely wouldn't survive. Is that how you heard it?
Yes.
And so based on that, you called your family members and your friends to come there and support you, I presume, and support your mother.
Yes.
Were those individuals able to arrive at the hospital prior to your mother passing?
Yes.
You remember when you were interviewed with Columbus Police Department in 2019?
Yes.
Your father was in that interview with you as well.
Yes.
That interview that you gave to Columbus Police, I think that's the only time that you've been interviewed in this case?
I believe so.
Does that sound right? And obviously 2019 is closer to 2018 than we are today. Do you agree?
Yes.
I think in that interview, there was questions that you and your father were asked about providing comfort to your mother. Do you remember those questions asked?
I believe so.
Both you and your father, particularly in light of the experience with your brother, indicated that you just wanted your mother to be comfortable.
Yes.
And you mentioned the experience of your brother, did you not, in this interview with the Columbus Police Department?
Yes.
And it was, as you stood in the hospital in Mount Carmel in 2018, John, fair to say that you couldn't, well, tell me, you couldn't not have been still thinking about what happened to your brother in 2007, right?
That is true.
Does it sound, I know you were asked about individuals and who people wearing scrubs. Fair to say that during the Columbus Police Department interview, I think you were asked about whether you'd seen pictures of Dr. Husel on the news.
Yes.
And you indicated that you had.
Yes.
But you said, I've seen pictures on the news, but you really weren't sure if he was someone that you had had a conversation with.
I said we did not have a conversation with him. He was, from what I remember, after seeing the pictures, he was in the nursing station.
He was at the nursing station in the
ICU.
In the ICU. And then just wanted to go back to some questions you were asked about when you said, I think, that you saw your mom jerk her hand. Do you remember during the Columbus Police Department interview with your father that it was unclear whether your mother was actually having seizures in the room Were you in there when it appeared that she might be having seizures?
I was there when she jerked her hand. I wasn't sure about the seizures.
And then you testified that a nurse came in and gave her some medicine and it seemed to help.
Yes.
This is while she was still on the ventilator.
Yes, ma'am.
So she was able to settle down a little bit after she got that medication. And then at some point, as I know you talked to the police about, was it your father that asked you to go talk to the nurse because he didn't want this to go on? Do you remember that?
Yes.
And I know on direct you testified that you weren't the next of kin, but your father was upset at the time.
Yes.
And while he was upset, he asked you if you could go get the nurse and essentially communicate the decision that had been made. Is that right?
No, I went and got the nurse to tell him that she wanted him to come in because she was jerking her hand.
Oh, so that's when your father was witnessing that your mother was moving.
Yes.
And so you went and got the nurse, and the nurse came in and then gave the medication.
She came in, and my father had told her that he wanted her to be comfortable, and she left the room and went, I'm assuming, to the nursing station, and then she came back with a needle or syringe and put something into the IV.
Then you mentioned just about that you were asked to sign something. Just to be clear, you weren't the next of kin for your mother, is that right? That was your father.
Yes.
And so as you were in the hospital in 2018, fair to say you knew that ultimately it was your father that had to communicate the decision about whether to palliatively extubate her?
Yes.
Do you remember the paper, was it after your mom's passing when the chaplain asked you to sign something as to what you would like done with your mother's?
No, that was the nurse in the ICU that had asked us.
The nurse in the ICU asked you?
Yes, the dark-haired lady.
Okay. And certainly when your mother was extubated, because there was a time when the ventilator was removed from your mother, is that right?
I do not recall if it was removed or not.
Because I think you told the Columbus Police Department that at that time, sort of when that was all happening, you were very much in and out of the room. Do you remember saying that?
I do not, but I may have.
And so you don't even remember if your mother was still on the ventilator when she passed or not?
No.
But you do remember that your father was there holding your mother's hands when she passed?
Yes.
And she was surrounded by loved ones?
Yes.
Nothing further.
Redirect.
Couple questions, thank you, Your Honor. Did you ever have a conversation with William Husel?
No.
What was he doing when you saw him?
I'm sitting at the nursing station. I'm assuming looking at the monitors. And
How close to you was he when you saw him?
I would say from here to Mr. Zion, maybe.
Okay. Did you ever acknowledge each other?
No, ma'am.
Make eye contact?
He may have looked at me when I looked out at the nursing station when I went out to get the nurse, but nothing was ever spoken.
Okay, thank you.
Your Honor, I have one follow-up if the court would allow permission.
I'm going to object to that, Your Honor.
Okay, gotta go sidebar on this one, ladies and gentlemen.
You set your computer back.
Hold on, let her be up. Go.
You remember in the Columbus Police Department interview you had on February 22nd, 2019, in answer to the question, does Dr. Husel look familiar, you initially answered, not that I can say for sure, but, and then you went on to say, but it's been over forever. Do you remember saying that in the Columbus Police Department interview?
I do not recall.
Nothing.
Okay. You may step down, sir. Thank you. Call your next witness.
Thank you, Your Honor. She actually stepped out of the room. I could have, oh, okay. Your Honor, at this time we call Beverly Leonard.
Sorry, come on up. You need to raise your right hand. You solemnly swear to tell the truth, the whole truth, and nothing but yourself, you know.
I do.
Go ahead and make yourself comfortable. You've been watching the routine. You got that mic there in front of you. Okay. Why don't you go ahead and state?
Colder back there than here.
You ready?
Yes, my name is Bev. I go by Bev. It's Beverly Leonard. Beverly Leonhard.
Okay. Ms. Grove.
Thank
You
you.
guys hear okay? You guys good? Okay.
Bev, do you reside in Central Ohio?
Yes,
How long have you lived here?
my whole life.
Okay.
68 years. 67.
Thank you. Talk to me a little bit about your family history, your husband, kids, and grandkids.
I have 2 children and 2 grandchildren. My husband and I spent the first 7 years of our marriage in the Navy. He was the sailor, I was the wife. And we traveled wherever we were stationed. We were very active in our kids' lives and just a normal life.
Okay, thank you. Were you raised in Central Ohio?
Yes, I was raised in Grove City.
Who are your parents?
Joe, well, his real name's Winfrey, but he goes as Joe, and my mom, Melissa.
Was your mother one of the alleged victims in this case?
Yes, she was the last victim.
Thank you. I'm going to place on the projector State's Exhibit 14A. Who is this lady?
That's my mom.
Okay, thank you. Is your dad still living?
Yes, he is. He turned 90 last Thursday.
Yeah. Is he in the courtroom today?
Yes, he is.
Thank you. Tell us a little bit about your mom and dad.
My dad worked for Big Bear almost his entire life. Mom was a stay-home mom until the boys got in high school, and then she got a job. She worked at Sears Distribution in the mailing system. She also worked at H&R Block during tax season as a receptionist. They were very active. They had a group of friends that were also Big Bear retirees that they would go to Myrtle Beach and Gatlinburg, just different places. They would go down to Brenfo Valley and listen to concerts. Anytime there was some kind of musical concert, my mom would want to be there. And Gary and I took a trip once with them to Nashville, and she was very active in the kids, the 3 of our lives, and in all 5 of the grandkids' lives.
Okay, thank you.
Oh, great-grandkids. 5 grandkids, 4 great-grandkids.
Do you know about what year she retired?
No, I don't.
How many years of retirement had she enjoyed at the time of her passing?
Well, they were in a head-on collision in 1977, and that slowed her down a little bit as far as for back pain, but she still went and did everything. Like I said, for maybe 12 or 14 years, I'm not quite sure of the time, but they had a place in Florida that they went to every winter and stayed there, so Mom could shop all the time.
Okay. Bev, are you currently employed?
No, I am what you would call retired.
Okay. And were you ever employed?
Yes, I worked for Dr. Kravitz, Arlington Foot and Ankle Center, and Greater Columbus Foot and Ankle Center, 2 offices that he had. And I also worked at H&R Block during tax season. And I was, basically my whole life has been volunteering for Southwestern City Schools in the city of Grove City.
Okay. And what kind of a doctor was Dr. Kravitz?
Podiatrist.
Okay. And did you have any special training to work for him?
No. Another friend of mine worked for him, and she more or less just trained me. It was a 2-person office, just the doctor and myself.
What did your duties consist of there?
I greeted the patients, took them back to the room, would do their paperwork, do progress notes in the charts. I would take x-rays. I developed x-rays. I would assist in the rooms whenever he was doing an office procedure. I scheduled surgeries for him, cleaned the office, painted white stripes in the parking lot for... I mean, yeah.
Good avoid.
Yeah. So just about anything that was needed. I was the one that ordered supplies, so...
Okay. Did you receive any special training to work with him or while you worked with him?
He taught me some things. I mean, he taught me how to like draw up lidocaines, when he was maybe doing an injection for plantar fasciitis or and developing x-rays. He taught me that.
Okay. And how long did you work for him?
About 15 years. When my daughter got pregnant, I gave a 9-month notice because I was going to be the grandma stay-home babysitter.
Okay. And did that come to pass?
Yes, it did.
Okay. And did you enjoy that?
Yes, absolutely.
Okay. And did you share the joy of that little one or others with your mom and dad?
Yeah. Because I babysat my granddaughter Lauren and eventually my grandson Luke, we would go to Mom's house at least a couple times a week, sometimes even 3 times a week, because she literally found joy in just sitting and watching them play, or she would, get on the ground and color with them, or they'd bake cookies together. Or she would, my grandson loved having his hair combed. Almost as soon as he would go in the house, he would go in the bathroom and get a brush and then go lay his head on my mom's lap, because she liked brushing his hair and he loved having it brushed.
Okay. And how old were your grandchildren at your mom's passing?
7 and 10.
Okay. And are those both your daughter's kids?
Yes.
Okay. Do you have other grandchildren?
No, my son doesn't. No.
Okay.
Pam, would you let her finish the question? Yeah, I know you want to tell us everything, but you kind of stepped on her a second, so let her get the question out.
I'm sorry?
She was asking you a question and she wasn't quite finished with it?
She asked me if my son had grandkids, and I said no.
Not exactly, but
I apologize.
just make sure that she finishes her question.
Okay, I'm sorry.
Because it's tough on her if 2 people are talking.
Thank you, sorry.
Did your mom maintain any memberships to any organizations or groups?
Not true memberships. She was in a card club and she was active in her church. Whenever the church had a reason to have a dinner at the church, she was always called on to bake something, make something, cook something. And like I said, other than card clubs, not anything official membership of.
How would you categorize her state of health in the months leading up to her death?
Excuse me. Again, she always had backache. I mean, she just lived with that. She wasn't one to complain a lot. I do know that in August and September of that year. She was dealing with candida of the esophagus and had been on antibiotics for that. And, you know, like I said, they still went things. They would go down to Wheeling, to the casino. They went to the Noah's Ark thing in Kentucky. We have a boat in Kentucky, and they came down that June of 2018 to our boat, which is a 4.5-hour drive, which she obviously had no issues with. And we would go out on a pontoon and stuff, and she loved that because she loved the water.
Mm-hmm. Okay. And was she still driving at the time?
Yes.
What about cooking or gardening?
They had kind of gone past their ages of really wanting to put up with gardening, but she did pull weeds when she saw them sitting on the front. When she would be on the front porch, she would pull weeds. Cooking, her favorite holiday is Halloween, and she would. It was a big deal in our family. Everybody would go there, and some friends, and Mom would fix potato soup, chili, bean soup. My dad would order pizzas. Mom would bake pumpkin cookies, and she did that October.
Okay. Do you remember your mom's exact date of death?
I'm sorry?
Do you remember your mom's exact date of death?
November 20th, 2018.
And how old was she at her date of death?
82.
What do you know about your mom's medical history?
I know that she, excuse me, like I said, her back had bothered her since that collision. She had idiopathic peripheral neuropathy. She was not a diabetic.
Say that again, please.
Idiopathic. I don't spell, do I?
What's the rest?
Yeah. That would sometimes be, some days would be better than others because her feet would be numb, and sometimes that would just, she was past the point where the nerves die, so it wasn't as bad in the last few years. And I know that she had stents put in her heart stents in her arteries.
To your knowledge, did your mom have any previous hospitalizations or surgeries?
Oh, yes. She had, years ago, she'd had a hysterectomy. She had, she was once had kidney stones. I mean, this was like 50 over years ago. They put her in an induced coma so that she could get over the pain of the kidney stones. But then she had a knee replacement a few years ago, and she slipped and tripped over a throw rug in the house and broke her hip and had that hip fixed. And she went through physical therapy for all those and was fine after that. Trying to think of what. Oh, she also had a toe amputated that would not heal because of the way it rubbed up against her other. It was constantly always getting infected. She had a toe hip amputated.
Thank you. What about your mother's medication regimen?
I know that she took a multitude of medication. I know she took some for her high blood pressure, maybe an antidepressant. She was prescribed morphine from her family doctor for her back that she would take as needed. No, not as needed, but usually at night. At one point, she was on Topamax, which was for the neuropathy, but I'm not even sure she was still taking that.
Okay. Did your mom have limitations?
Not really, no.
To your knowledge, was she still leaving the house before she went to the hospital?
My dad liked to clean the house, and she liked to go behind him and clean it. Yes, she was still, and they had ironing boards set up in the basement, and that would make it necessary for her to go down 2 flights of steps, and she would go down there to do her ironing.
Okay.
She'd also just painted the back porch they had that spring. I believe maybe it was in May or something. So she still did, whatever she wanted to, more or less.
Okay. Do you remember the days leading up to your mom's last hospitalization?
Yes.
Do you remember why she went to the hospital?
The morning of the 15th, I went over that morning, and she was sitting at the kitchen table eating breakfast. My dad was back behind us at the sidebar thing, and she was not feeling well at all because she had just finished that antibiotic for the candida in her throat, and she just didn't feel like it was gone yet. And at the time, she said, I'd been coughing up a little bit of blood, and she had coughed into her napkin. And in the phlegm, I did see a pink tinge in the phlegm on her napkin. She was eating cereal, and then she was finished, and we both walked into the living room, and she sat down on the couch, and I laid down on the couch and put my head on her lap, just talking.
Okay. And was she expressing concern about her situation?
That day, yes. She said, I didn't notice it when we walked to the couch as far as her having difficulty breathing, but she had said that she just felt really tired and was having a hard time breathing. But she was also still having intermittent stomach pains and the candida that she had been having since August.
And how many days before she went to the hospital was this?
I'm sorry?
How many days before she went to the hospital was this?
Was that?
This conversation?
Oh, she went that evening.
Okay, all right. Now, do you remember how many days your mom was there?
5 days.
And do you remember who was visiting your mom during this hospitalization?
I know my son went that very night. We were at a concert for my granddaughter, and my son went from the concert to the hospital. And, of course, my dad was there every day. I was there, I think, every day. My daughter was there almost every day also. My brothers both visited, and my aunt and uncle, my dad's brother and his wife were there one day, and I have a cousin that's a nurse at Mount Carmel, and she would come up and visit my mom too before her shift or after it.
Okay. How often were you going?
Once a day, and I would stay 4 or 5, 6 hours, it depended.
How about your daughter? How often was she going?
I really, truly am not sure. I know that she was there when 2 different physicians talked to her, and I know she was there on the late afternoon, evening of the 20th.
Okay. What about your dad? How often was he there?
He was there every day, and sometimes if somebody else came up, he would run home to eat lunch. If not, then he would just go down to the cafeteria and eat.
Okay. How was he getting to the hospital every day?
He drives.
Okay. Do you remember the course of her hospitalization?
When I went in to see her, the first time I went in, she was, I think, maybe on the 3rd floor. I'm not 100% sure. And she had a huge coil of tubing that went to the oxygen that was just in her nostrils. And she kept telling my dad and I that she wasn't feeling the oxygen. She wasn't feeling the oxygen. So when a nurse, I'm assuming, was a nurse came in, a female, we told her that. My dad told her that. And so then they had left it that big because she was getting up and sitting down or going to the restroom by herself and stuff. So they shortened that. And she kept telling my dad again later that she still didn't feel like she was getting any, and he eventually, finally, took it out and felt it, and there wasn't anything coming. So they then moved her to another room and put the kind of mask-like thing on her for a while because her oxygen had been depleted from that tube, not that oxygen in that room not working.
Okay. How many different rooms was she in while she was in the hospital?
Counting ICU, she was in 3.
Okay. So there would be 2 rooms in a regular
Correct.
ward and then the ICU.
Correct.
Was she voicing any concerns while she was in the hospital?
Once they put her on the mask in the second room, she complained that her back was hurting her because of the position they had her in. And she was told that that's the position she had to stay in. And I was there at one point when she had an episode of the intermittent stomach pain that she went to the hospital for, and she just pulled herself up out of the bed and wanted to get up because she wanted to go to the bathroom, and they told her that she couldn't get up because she had to stay on. Whenever she did move or something, her oxygen rate would go down or count, so they told her she couldn't go to the bathroom. They'd bring in a bedpan or whatever.
Just to circle back, did she have oxygen at home?
No.
Any other complaints that she was voicing while she was there?
Not until the day she was in the ICU.
Okay. What were they doing for her that you could see happening while she was
in the room, in the regular room? The doctor was Deborah, and the last name starts with a W. I can't pronounce her name, but she spoke to us once and told us that they had did an X-ray, I believe, in the ER, and she had pneumonia in her right lung, and it was only in one lung, and that's why they were going to put her on the oxygen and she had been short of breath. And I asked if they had taken a culture of the phlegm that she was spitting up that had the pinkish tint to it, and they said no. Eventually somebody did bring a culture and laid it on the back thing of the bed, but I didn't witness anybody doing it or anything. And she kept asking for a suppository because she hadn't had a bowel movement for like 2 days prior to going to the hospital, and here she was in the hospital 3 or 4 days and still hadn't. And she wondered if that would be part of her stomach pains. And she threw up one time, and I cleaned her up. And somebody else came in the room, some male, and he and I cleaned her up and changed the sheets and everything. And then right after that, she was worn out because we tossed her around so much and everything. And after that, 2 women came in to raise her up and put an X-ray underneath her to X-ray.
Okay. Had she left
Let's hold on. We're getting to the time. Ladies and gentlemen, the jury, I'm going to send you to lunch like I indicated yesterday. Okay? Remember the admonitions. We'll get started at 12:30. Okay?
All right.
Have a great lunch, guys. You may be seated. Man, we're going to be on break for an hour.
Okay.
You're not to discuss your testimony on the stand. You've heard me say this many times, okay?
Okay.
You can answer a factual question for somebody, but as to how you testified and what you testified to, it's off limits.
No problem.
Fair enough?
Thank you.
Thank you. Ms. Scrub, anything for the record?
Nothing at this time, Your Honor.
Ms. Menashe, anything for the record?
No, Your Honor, thank you.
Mr. Baez?
No, sir.
Okay. We'll break for lunch.
Time back, Your Honor.
12:30.
Thank you.